Welcome back, everyone. With us now here on North Dakota Today, we're checking in with Dr. Susan Matheson with Catalyst Medical Center and Clinical Spa to talk about keeping yourself healthy from home. Dr. Matheson, thank you so much for joining us today. First off, before we even jump into some of the topics, can I just ask you how you're doing, how you're holding up?
Well, thank you so much for asking. I'm actually on call this week. The beeper just went off, and so I've got to make a call as soon as we're done. I was in the operating room a couple nights ago, and the team and I were able to save someone's life and save his eye. So that was kind of an exciting but kind of dangerous time. I was suited up in full battle gear. I take call at Essentia, even though I have an independent practice, and they had all the appropriate personal protective equipment. The whole team was basically in battle gear, just like those hazmat suits that you see on TV. So, it's stressful for medical professionals. I haven't been able to spend time with my son because we're social distancing. We're basically working a skeleton crew at the office and trying to see just emergent and urgent and time-sensitive patients. So life is very different, and I feel for my brothers and sisters in medicine in bigger cities. But I'm grateful that we live in a place where we have great leadership, and I think health systems are taking appropriate steps, and I think our community also realizes the importance of doing the right thing.
Well, thank you so much for what you do. We talk a lot about it, but you're the face there, the medical personnel who are, still doing what they need to do, even under these, unusual and kind of scary conditions right now. We wanted to talk to you a little bit. You just said it's kind of a skeleton crew at Catalyst. You're trying to keep everyone safe. I know you're doing some telemedicine. Is that true?
Absolutely. It's been fun. So just like you and I are able to talk, I can talk to patients in just the same way. And, in training, they always tell us that 90% of the diagnosis is the history. And so it's really a time where we get to focus on conversation and questions and really digging deep into people's problems. So it's actually a really great way of communicating with patients. I hope that we'll actually see a little bit more of this in the future, because I think it's a great opportunity. It saves people travel time. There's lots of benefits to it. Obviously there's some things we need to see in person, but it's a great option for especially this time in our lives, but also hopefully it'll be more accessible in the future too.
I think that's interesting, and I think you're right on that too. Since we have you, we wanted to ask you a couple of questions about mask usage, safety. There's some talk now about, everyone, when they're outside of their home, maybe being encouraged to wear a mask. What are your thoughts on that?
Absolutely. I've been promoting this on my Facebook page for the past few weeks, and the data coming out of the Asian countries where mask use is very common, is that it's helpful. The regular public does not need medical masks, but homemade cloth masks. There's some really creative things that you'll see on the internet. They can, and basically, minimize some of the, droplet exposure that people might come in contact with. So if we have widespread mask use, I think it would be helpful. I think the original recommendations were meant to conserve medical supplies, but now they really realize that part of the ability of certain communities in Asia, such as Hong Kong and Singapore, they were able to keep their rates lower because they did have widespread mask use. So I'm telling people to make those cloth masks, make them for others, but also make some for yourselves, and make a little slot where if you feel called to, you can slip in a little filter made of a vacuum bag. I do think that they're helpful. Make sure they're tight fitting. Ideally wear glasses or some kind of shade so it protects you can protect your eyes too, but the majority of the virus comes through either droplet exposure when you're close to a person or from you yourself touching a surface that has virus on it and transmitting it to your nose or your mouth. So it also prevents you from touching your nose and your mouth. So that can be a benefit as well.
We need something because we're doing it without even thinking about it. Dr. Matheson from Catalyst Medical Center and Clinical Spa, so great to visit with you even through Skype. I appreciate your time.
Thank you very much.
We'll be right back.